Welcome back. Well, next Monday, the other Royal Commission, the one into aged care, kicks off its second session focusing on home care. We've already heard awful stories about service and fee gouging. Sounds familiar, doesn't it? But there are also big structural problems, you'd think, and the elephant in the room seems to be that there's simply not enough money to go around. The home care wait list currently stands at over 126,000 people wanting help, wanting to stay out of nursing homes. Well, Peak Oldies Group, National Seniors Australia, has now upped its calls from a doubling to a tripling of level 3 and 4 home care packages. National Seniors Australia Chief Advocate Ian Henschke joins me live from our Adelaide studio. Ian, great to see you there. Of course, Adelaide was where it was all kicked off, investigations, I suppose. What are you asking for, hoping for from the budget?
Well, I think this is an opportunity now for the government to actually take some action. We don't have to wait till the end of the Aged Care Royal Commission to discover what the problems are. You've just put it in a nutshell there, Tiki, beautifully expressed. 126,000 plus people waiting. To put that into perspective, that's the MCG completely full, packed with people, with 26,000 people waiting outside. And some of those people that are outside waiting are dying while they're waiting. This is what the Royal Commission's heard. In fact, they were terrible stories so far. The Royal Commission's had a session already in Adelaide. It's now taking to the regions, coming back to Adelaide, as you said, to look at home care. But we know that people want to stay in their own homes. There's a report that's just come out today that says that only 14% of Australians die in their own home, but nearly half of all Australians would say they'd like to. We know from National Seniors Research that most Australians want to be cared for in their home, not go into a home.
What is stopping this? Is it just money? Is it that the networks aren't there? Is it that people don't actually understand? I mean, I, for one, don't actually know what the difference between a level 3 and a level 4 package actually is.
Well, I can tell you what they are because I can tell you from personal experience. My brother put a submission into National Seniors and I encouraged him to put it directly into the Royal Commission, and it was about the situation with his wife. She had an inoperable tumour on her brain. She wanted to be cared for at home. He put in for an aged care package. He received notification 1 year after she was dead that the package was available. Now, that is not that's not an uncommon story. What we are hearing at the Royal Commission is stories about people who are waiting. One of them was Kay Warriner. She went to the Royal Commission. Her husband, who has been waiting on the waiting list for so long that he's now suffering mental anxiety, mental issues about it, and he's got all sorts of physical problems. She wants to care for him at home, and you have these levels of care, level 1, level 2, level 3, level 4. By the time you get beyond level 4, you really are in an aged care home because there's not sufficient care that can be provided. But look, the situation is this. It's far, far more cost effective to keep people at home. We know that. So even from a pure economic point of view, the government should just simply let the moths out of its wallet, put its heart where it says it is, and actually get rid of that waiting list at level 3 and 4. They're the people that, if they don't get that package, will either die on the waiting list or they'll be forced into an aged care home because people can't look after them. And so, Tiki, I'll give you a couple of quick figures. 400,000 people from dementia at the moment, and a lot of them need help.
Yeah. Can they be looked after at home? If you've got low-level dementia, you presumably can be looked after at home.
Yes, that's exactly right. And look, there are some great home care providers out there, people that come around and they provide you with a couple of hours a day. They come in the morning, they help you get out of bed. I mean, there was at the Royal Commission we had a wonderful story about a woman who said that the last thing she wanted to do was go into a home. She had a stroke when she was 64. She's now 72. And she's been living at home for the last 8 years with a combination of a level 4 home care package and also a Commonwealth Home Support Program scheme as well. She needs the two of them together, but she says there's no way she wants to go into a home. She was a very senior public servant in Canberra, and she said that she's used up all the money, basically to stay at home, and she needs that help as well. It comes down to a couple of hours a day, but that living at home, in her own home, rather than being into an aged care home.
Ian, do you think, I mean, of course, the big issue now is the unlocking the value of the family home. What progress is being made there, do you think, and will anything work in the budget on that?
Well, politically, that has always been a problem for all parties. If you ask the major parties, they'll say, look, it's a no-go area. But very interestingly, Tiki, you might remember from last year's budget, there was a pension loan scheme which is now available to all Australians, not just pensioners, kicks in on July the 1st this year, and that enables people to actually have access to the equity in their home through Centrelink, and you can get as a couple $56,000 a year. Now, I can see people in the future using some of that money for home care. You know, there are a lot of people out there at the moment who are paying extra. They're not just getting these packages from the government for nothing. They actually have to contribute to them themselves. And then I've also spoken to a home care provider. He told me about a very famous Australian recently, a senior figure in business who made it to 100 years of age, and he was still working, and they were still assisting him to work, and they were still providing care for him virtually around the clock. So there are a lot of people out there that want to actually pay some of their money towards their home care.
Yes.
And look, the most important thing, though, is that you don't want to have a system where the rich can afford the care and the poor don't get any care. I mean, you've got to make it equitable.
So what are you, I mean, you must be talking to people both state and in Canberra. Is there a you know, dropping the ball between the two? And what are you expecting from the budget?
Well, one of the things that we're pointing out, and look, it's coming out in the Royal Commission, everyone talks about the cost shifting. Guess what happens? You see, an aged care home will now put someone into an ambulance and send them to the hospital, and the state ends up picking up the cost of that. We know there's cost shifting going on. What we know is that if we keep people in their own home, as I said at the beginning of this interview, it is going to cost a lot less for the government if we provide them with even some of the services that are in the hospital at home. That they can keep people at home with palliative care and other activities like that as well. So, I mean, I really think governments, both at a state and federal level, have to get together and say, look, we know what the problems are. I mean, the figures are extraordinary. I mean, by 2056, there will be more than 1 million Australians living with dementia. So we know that we need a workforce. Ken Wyatt addressed the press club last year, and he said that they are going to need a workforce. The EBS is giving the Royal Commission the figures. The thing is, the government, whichever government wins this next election, has to face up to this. This is not a problem that has gone under the radar. This problem is well and truly above the radar, and the bureaucrats, the people in taxation, the people in Treasury, the people in health, they've got to get together and they've got to fix it.
Ian Henschke, thank you so much for your time. That's great.
Thank you very much, Tiki.